Caring for an elderly person with cancer may seem like a simple matter of taking medication on time, taking them for regular checkups, and ensuring they eat well. But in reality, there's a whole system of subtle, deep-seated needs that many caregivers, no matter how dedicated, easily overlook. From misunderstanding the patient's emotions, to lacking knowledge about nutrition specific to cancer patients, or not recognizing the signs of underlying psychological and physical changes, all can make the treatment process less effective and seriously affect the patient's quality of life. In today's video, we will explore 5 important but often overlooked things when caring for an elderly person with cancer. These are not just small details. They can be the key to helping your loved one feel understood, supported, and live a more meaningful life, even while battling the disease. If you are accompanying your elderly parent or relative on the cancer treatment journey, this video is for you. Watch until the end to not miss valuable advice from experts and share to spread proper care to many other families. 1. Overlooking the patient's mental and emotional needs. In the journey of caring for an elderly person with cancer, most relatives focus on the most obvious and visible needs: medicine, food, hygiene, doctor's appointments. This is not wrong, but it is not enough, because there is something that is often overlooked, but extremely important: the patient's own mental and emotional needs. Imagine, when an elderly parent, father, or grandparent is diagnosed with cancer, they are not only facing a physical illness, they are facing the fear of death, the helplessness of aging, and the gradual loss of control over their own lives. They may feel scared, frustrated, useless, or sad about being a burden to their children and grandchildren, but they don't know how to express it. And if the caregiver, because of being too busy or stressed, only focuses on physical health and ignores the mental health, the patient will become increasingly withdrawn, suffer silently, and their quality of life will decline significantly. In the United States, many seniors live alone or far away from their children and grandchildren. Even when they have relatives around, the generation gap, the busyness of life, and differences in the way they express their feelings make it difficult to ask them deeply. Many older people, especially men, don't know, or aren't used to, expressing fatigue, depression, or loneliness. But that doesn't mean they don't feel it. A 74-year-old cancer patient in Minnesota once shared with a support group, "My child asks me every day if I'm eating enough, if I'm taking my medication correctly. But he never asks me if I'm scared. And I'm scared of pain, scared of not waking up after surgery, scared of having no one to take care of my wife if I die." This story, though small, shows the great inner loneliness that older people with cancer can experience. So what should caregivers do? First, take the time to really talk to the patient. Don't just ask, "How many spoonfuls did you eat today?" But ask, "How are you feeling? Is there anything you're worried about? Do you feel like I'm supporting you enough?" Gentle, non-judgmental questions will open up a safe space for the patient to express their feelings. Remember, talking is a way of healing. Second, pay attention to the silent signals. The person is less talkative, loses interest in things they used to enjoy, like listening to the radio, watching movies, talking, is irritable, has trouble sleeping, or cries alone. These could be signs of mild or severe depression, a condition that is very common in older people with chronic illnesses like cancer but is easily overlooked. If in doubt, don't hesitate to ask your doctor for a referral to a psychologist or community support group. Third, help the person maintain their role and dignity. Don't do everything for them, unless they can't do it themselves. Let them choose what they eat, when they go to bed, and even call the doctor for information if they are conscious. Older people don't want to be a burden. They want to feel useful, respected. Finally, if possible, take them to support groups, in person or online, where they can meet people who are going through the same thing, share their fears, and work through it together. Research shows that patients with positive social connections have a better chance of recovery and a significantly higher quality of life. Physical care is important, but emotional care, that's what nurtures the real strength to help older people fight cancer. And sometimes, just a caring look, a gentle question, or a timely handshake can make a huge difference. 2. Not monitoring the side effects of drugs and treatments closely. Small mistakes, big consequences. During cancer treatment in the elderly, Drugs and measures, such as chemotherapy, radiation therapy, or surgery all cause certain side effects. However, what is worrying is that many caregivers, no matter how dedicated, often take lightly or miss unusual manifestations that occur during and after treatment. The reason is often because they think it's normal, old people are weak, or because they do not know how dangerous those signs really are. Older people have weaker bodies, reduced liver and kidney function, and weakened immune systems, making them more sensitive to drugs and treatments than younger people. A mild pain reliever can also cause severe constipation. A mild course of chemotherapy in a 40-year-old may only cause fatigue, but in an 80-year-old it can lead to severe dehydration, low blood pressure, or malnutrition in just a few days. Common but easily overlooked side effects include mild but persistent nausea or vomiting, loss of appetite, eating less and less without anyone noticing, digestive disorders, constipation, diarrhea, bloating, mouth ulcers, sore throat that make the patient reluctant to eat, insomnia, persistent fatigue, mild confusion, repeated speech, poorer memory than usual, pale skin, dry lips, signs of dehydration. An inexperienced caregiver may think that the patient eats less because of old age, is forgetful because of old age, or lies down a lot because of fatigue from treatment. But if these small things are not monitored and reported to the doctor, they can cause the patient to quickly become exhausted, increase the risk of hospitalization, and even not have enough strength to continue treatment. Let's take a real-life example. Linda, 79 years old in California, after her first chemotherapy session began to eat less, was often tired and had loose stools. Her daughter thought it was a normal reaction and did not report it to the doctor. A week later, she was hospitalized for dehydration, hypokalemia, and a weight loss of 4.5 kilograms, which led to a delay in the next treatment and a prolonged recovery period. If she had been closely monitored and had electrolytes replenished earlier, the condition would not have become so serious. So what should caregivers do? 1. Observe carefully every day. Not only monitor temperature or blood pressure, but also note small changes such as eating habits, digestion, mood, mobility, etc. It is advisable to have a short diary or phone application to record, helping to communicate more clearly with the doctor when needed. 2. Ask your doctor about possible side effects. When starting a new treatment regimen, don't forget to ask, what reactions can this drug cause? What should I do if I have symptoms A or B? Knowing in advance helps you stay calm, handle the situation properly, and not ignore unusual signs. 3. Don't hesitate to contact your doctor. In the U.S., many hospitals have 24/7 medical lines or dispatchers who can answer simple questions. If the patient has strange symptoms, don't hesitate to wait until Monday. A timely call can help prevent serious complications. 4. Be proactive in scheduling follow-up appointments. Older people are often reluctant to travel a lot, but missing follow-up appointments can prevent dangerous side effects from being detected early by doctors. If it's not convenient to go to the hospital, ask about telehealth consultations so that the monitoring process is not interrupted. Remember, early detection equals early intervention. Caring for an elderly person with cancer cannot be based solely on a doctor's prescription. It requires the caregiver to be a pair of eyes every day. You are not a doctor, but you can be the one to spot what the doctor cannot see in a 15-minute examination. 3. Ignoring the important role of nutrition in the recovery process. Nutrition is the foundation of health. This is especially true for older adults battling cancer. However, one of the most common mistakes caregivers make is to ignore or not update their nutritional regimens to suit their condition and stage of treatment. Many people have the mentality that as long as they can eat, that's good enough, and try to force patients to eat traditional portions such as white porridge, vegetable soup, or boiled lean meat without understanding that cancer, especially when combined with chemotherapy or radiotherapy, completely changes the patient's nutritional needs and digestive ability. Older adults with cancer often experience loss of appetite, dry mouth, changes in taste due to medication, mouth ulcers, nausea, diarrhea, or constipation. In addition, weak teeth, a weakened digestive system, and psychological fatigue cause them to eat less, choose less diverse foods, or refuse to eat altogether. Unfortunately, when caregivers do not pay attention or are not flexible in adjusting the diet, the patient can easily fall into a vicious cycle. Eating less, malnutrition, weakened immunity, susceptible to infection, fatigue, muscle loss, difficult to continue treatment. This condition can occur very silently in just a few weeks if not detected in time. For example, Mr. George, 82 years old in Ohio, after 2 chemotherapy sessions, lost nearly 6 kilograms due to loss of appetite, frequent vomiting, and mouth pain. His elderly wife cooked him dishes like chicken porridge or bland vegetable soup because she was afraid that his salty food would affect his blood pressure. However, that diet lacked protein, calories, and made him increasingly weak. When they went to the nutritionist, they realized that he needed a high-energy diet, supplemented with liquid protein, and divided into many small meals a day, something that should have been done from the beginning. So, what should caregivers do to ensure proper nutrition? 1. Understand that each stage of treatment requires a different diet. During chemotherapy/radiation, patients may need to eat soft, easy-to-swallow, low-odor foods to reduce nausea. After surgery, they need more protein to regenerate tissue, along with soluble fiber to aid digestion. If you lose weight quickly, you need to add more calories through smoothies, medical milk, or appropriate functional foods. 2. Focus on quality over quantity. Older people do not eat much, so each meal needs to ensure high nutritional value. A bowl of soup can add protein from beans, eggs, minced meat. A smoothie can be mixed with peanut butter, yogurt, and oatmeal. Ask a nutritionist or use free tools from organizations like the American Cancer Society to plan a reasonable menu. 3. Divide your portions into small portions. Do not force feed too much. Instead of 3 large main meals, divide them into 5 to 6 small meals, with snacks in between, almonds, crackers, high-protein milk, etc. The patient will eat more easily and not feel pressured. 4. Always monitor weight, eating level, and post-meal reactions. Note the amount of food eaten, how you feel after eating, fullness, diarrhea, stomach pain, etc., to discuss with your dietitian. This will help you adjust your menu more appropriately over time. 5. Don't be afraid to use medical support. If the patient has not eaten enough for more than 1 week, talk to your doctor about liquid nutrition supplements, vitamin supplements, or even intravenous nutrition support if necessary. Finally, remember, every meal is part of treatment. Elderly people don't just need to be fed, they need to eat right, eat enough, and eat in a way that makes them feel comfortable. Recovery from cancer is more than just a prescription. It starts with the first spoonful you give them. 4. Not adjusting the living environment to suit the patient's health and safety. When caring for an elderly person with cancer, an important factor is often overlooked. That is the living environment. No matter how well the patient is treated, how well he or she eats, how much medicine he or she takes, if he or she lives in an unsafe space, too inconvenient or not suitable for his or her weakened physical condition, the risk of relapse, falls, exhaustion, or depression is very high. The elderly, especially after chemotherapy or surgery, often lose strength, feel dizzy, have weak limbs, and have reduced balance. However, many families do not adjust their living space in time, still keeping high stairs, slippery steps, toilets without handrails, or beds that are too low or too high. A small slip in the bathroom can lead to a broken hip, an injury that often causes the elderly to lose their mobility permanently. A typical example is Judith, 81 years old in Florida, who had early-stage lung cancer and was recovering well from radiation therapy. However, she fell in the bathroom because the floor was slippery and there was no handrail, resulting in a broken femur. Since then, she has been unable to walk normally, became depressed, and had to go to a nursing home. All the efforts of cancer treatment were almost wasted because of a completely preventable incident. So what should caregivers do to ensure a safe and suitable living space? 1. Reassess the patient's entire main living area. Put yourself in the position of a frail elderly person who has just been treated for cancer. They may have difficulty getting out of bed, walking, bending down, opening doors, climbing stairs, etc. Check all walkways for obstacles. Are the areas easy to move with a wheelchair or walker? Is the bed at a level that the patient can sit down and stand up by himself. 2. Install the necessary support devices. Some simple but extremely effective changes include handrails in the toilet and shower, non-slip shower chairs, non-slip floor mats, or removing rugs that roll up and cause tripping, sensor night lights in hallways at night, medical call bells or fall alert wearables. In the U.S., many nonprofit organizations and insurance programs, such as Medicare, can partially cover the cost of these devices if prescribed by a doctor. 3. Arrange everything within reach. Medications, phones, water, tissues, TV remotes. All should be placed near the bed or recliner so that the patient does not have to stand or reach far. Avoid having them climb to reach high objects or bend too low, which can cause dizziness. 4. Adjust the temperature, lighting, and sound appropriately. Older people are often sensitive to cold or hot temperatures and are prone to insomnia when the room is too bright or too noisy. Make sure the bedroom is warm enough, has soft lighting, basic soundproofing, and can open the window to let in natural light every morning. It will improve your mood significantly. 5. Prepare an emergency fall prevention plan. Post the emergency phone number and the number of relatives on the wall in a visible place. If you live alone, the patient should have a smart wristband that can detect falls and call for help. Many technologies now support this at a reasonable cost. In addition, you should also talk to a medical staff or rehabilitation specialist for a home safety assessment, a service that can be supported by health insurance in the U.S. A safe living environment is a prerequisite for the elderly to effectively treat cancer and maintain quality of life. An unadjusted home can be the most dangerous place for the patient, but a properly designed space will be a silent support to help them confidently recover every day. 5. Not learning about or taking advantage of medical and emotional support services for seniors. In the journey of caring for an older adult with cancer, many devoted family members and caregivers try to do everything on their own, from physical care to medication to emotional support. However, a common mistake is not learning about and not taking full advantage of the support services available in the community, hospitals, and the U.S. health system, which can provide significant medical, emotional, and financial support. In the U.S., there are many programs, organizations, and specialized care services for older adults with cancer, but most caregivers, especially children, older relatives, or those who live far away, do not know about them, or do not dare to use them because they are afraid of being a bother, wasting money, or because of the I can do it myself mentality. In fact, taking on everything on your own can not only exhaust caregivers, but also leave them overlooking important aspects of their patient's recovery journey, from mental health to end-of-life quality of life. Here are some common types of support that caregivers often overlook. 1. Palliative care. This is a comprehensive service that provides pain relief, symptom management, emotional support, and treatment guidance for people with cancer at all stages. Unlike hospice, palliative care can begin at diagnosis and be coordinated with treatment. Many major hospitals have dedicated teams, and Medicare largely covers this service. However, many people still think of it as end of life and miss out on opportunities to improve their quality of life. 2. Hospice, compassionate and dedicated end-of-life care. As cancer progresses to its final stages, the goal shifts from cure to pain relief and emotional support. Hospice services provide doctors, nurses, counselors, and sometimes home care, helping the patient die peacefully, painlessly, and with loved ones present. Many families are unaware that Medicare covers nearly all hospice costs if the patient qualifies. 3. Support groups. Older adults with cancer may feel lonely, helpless, or marginalized. Many hospitals, cancer centers, and nonprofit organizations, such as CancerCare, the American Cancer Society, and local organizations offer online or in-person chat groups where patients can share with others in similar situations. This can help improve mood, increase motivation, and provide emotional support for caregivers. 4. Home health care. This is a very popular healthcare service in the United States, in which a nurse or caregiver visits your home to provide health checkups, administer medications, care for surgical wounds, and report progress to your doctor. Caregivers do not need to do it all alone, especially when they can coordinate well with specialists. Home health care is often covered by Medicare with a prescription from your doctor. 5. Financial and legal advice. The cost of cancer treatment can be a huge burden. Many people don't realize that there are financial assistance organizations like the PAN Foundation, Good Days, HealthWell, or professionals who can advise on how to get the most out of Medicare, Medicaid, or private insurance. Additionally, cancer centers often have social workers who can help guide you through making a living will, choosing a healthcare representative, and other important legal decisions. Caregivers shouldn't have to do it all alone. Taking advantage of support services doesn't mean giving up. It means knowing how to mobilize the resources around you to care for your loved one in a more scientific, comprehensive, and humane way. Remember that in America, there's no shortage of help. The important thing is to know how to ask questions, learn, and ask for it. Caring for an older person with cancer is more than just reminding them to take their medication on time or taking them to regular checkups. It's a journey that requires a lot of observation, knowledge, and deep empathy. As you can see, seemingly small things, like a poorly prepared meal, a forgotten bathroom handrail, or a negative emotion that goes unheard, can have a serious impact on treatment and recovery. Older adults are already vulnerable. When they develop cancer, that vulnerability needs to be supported not only by modern medicine, but also by love, understanding, and professional support from the community. As a caregiver, you have the right to rest. You have the right to ask for help. And you have the responsibility to make sure your loved one doesn't miss important things in their journey to fight cancer. If you are caring for a parent, loved one, or an older adult with cancer, start by asking, am I listening to them enough? Am I missing something they can't say out loud? Backhand index pointing right, share this video with those who are on the caregiving journey to let them know they are not alone. Backhand index pointing right, subscribe to the channel to receive more practical, touching, and useful content about elderly care. Because love, sometimes, does not need too many words, just enough understanding, enough care, and not missing the silent things.